We know that COVID affects children less than it does adults. They make up less than 1% of the total deaths since the pandemic began. That said, Children's Hospital in Colorado Springs is seeing a record number of hospitalizations this winter season.
And the number of kids waiting in the emergency room is also skyrocketing. KRDO News Channel 13's Andrea Herrera is live at Children's Hospital Colorado after speaking with doctors who say a lack of vaccinations is the problem. Andrea.
Doctors at Children's Hospital tell me that they are seeing an uptick of COVID-19 cases within babies and young toddlers younger than 3 years old. And they say although the flu season is close to ending, the probability is still very high that kids can become infected with COVID-19.
The very beginning of the pandemic, we actually saw a lot of kids missing out on their well child checks, and unfortunately we've never really caught up on that.
Jessica Cataldi is an infectious disease physician and a pediatrician at Children's Hospital. She says this flu season is hitting school-age kids and those younger than 3 years old especially hard. Oftentimes, kids are being hospitalized due to respiratory complications.
Unfortunately, children have not been getting COVID vaccines at the rates that we would like.
Currently, data from the Colorado Department of Public Health and Environment shows that the vaccine rate for preschool-age kids in El Paso County sits at 92%. However, statewide, numbers paint a different picture.
So statewide, kids, in the preschool age group really are only around 15% have gotten a COVID vaccine.
That low vaccination rate means that infants and toddlers are now at a higher risk of complications from COVID-19 compared to teens.
It's about as high as it is among teenagers, and yet we don't see those kids getting protected with vaccines yet.
Doctors at Children's Hospital in Colorado Springs say they would like for the vaccination rate to be closer to 95% and suggest all parents think about boosters for their kids. Doctors also say they are seeing more viral infections this time around, which is why they are urging people to make sure their child gets vaccinated.
Andrea, the American Medical Association now says COVID-19 is a leading cause of death among children, despite a low mortality rate overall. So what are doctors saying about the potential long-term dangers of COVID-19 for kids who contract the virus at such a young age?
Yeah, Heather, doctors are saying that their worst fear is that kids can get myocarditis, and that is a serious heart condition. And basically what happens then is kids have a hard time breathing and they feel very tired. And the worst thing about that is it can develop into a heart condition later on, and even some of them can experience heart failure, which is why they are urging parents to make sure that they get their kids vaccinated against COVID-19. Reporting in Colorado Springs, Andrea Herrera, KRDO News Channel 13.